What's up, Ham Fam? Welcome back to another episode of Hard as a Mother. It's season 2, episode 2, and we're excited to be back in studio. I am your hostess with the mostest, Jizzy, and as usual, beside me is my lovely co-host, Harleen. Pew, pew, pew. So we're just two moms on a mission to create a safe space for other moms and dads or caregivers, whoever really, to share the honesty and the realness that comes with parenthood, while also being able to laugh at ourselves. So
I'm still trying to get used to this, but anyways, welcome back. It's season 2. I'm so excited to be sitting in this comfy chair, and life has been incredibly busy that I feel like every time I sit here, it's just me. It's just me time.
Like time just stops,
and I get to just vent and do whatever, whatever. It's just me.
Have adult conversations.
Yeah, I'm tired of having where's my socks? Is this clean? Is this that? Anyways, we are happy to be back, and it's season 2, and we have all these amazing guests lined up. But today we have she's fantastic. You guys will see. Anyways, there's all these amazing new things that's heading our way, as well as events. You guys will see it up in the upcoming months, and we are excited to share them with you.
Yep. And don't forget to save the date. June 24th is our 3rd annual golf tournament.
3.
Yes.
For the people that told us we didn't know shit about golf and we couldn't do it, it's our 3rd year.
It's our 3rd year for the incredible One Body Village charity. So we're excited for that to come up. And also, did you watch the Oscars?
Not really. Briefly, just to see what people were wearing.
Yeah, me too. I don't really care for the Oscars, but
neither do I.
But Michelle Yeoh won and she's the first Asian to win an Oscar in that category.
Woo woo! First Asian.
And so, ladies, as she said, never let anyone tell you that you are past your prime. And the reason why I bring that up too is because our next guest, we wanted to discuss the benefits of acupuncture, especially when it comes to reproductive health and fertility. So our guest today was born and raised in Calgary, and she studied psychology for 4 years, decided to go back to school for traditional Chinese medicine. After she completed her doctorate in that, she decided to take her education one step further by completing sports medicine acupuncture. And so she left for California to train with one of the top sports medicine acupuncturists in the world, and has been fortunate enough to treat athletes from all over the globe. So we want to welcome Dr. Amanda Perizzolo.
Hi.
Woo! Hi, Amanda.
Welcome. So excited to be here. Thank you for having me.
Thank you for coming. And tell us a little bit more about yourself and what you have here. And so your business is called YYC Acupuncture?
Yes, my business is called YYC Acupuncture, and I'm out of 2 clinics right now. Evolve Chiropractic and Wellness, which is downtown Calgary. And I've been there for just over 8 years. So I have an amazing practice there. Oh, my patients are so great. And we have such amazing colleagues. So I work with chiros, naturopaths, physiotherapists, osteopaths, massage therapists, just a whole team of just amazing people. Mm-hmm. So it's really nice because it just benefits the patients that much more. And then I work at another place called Mission Acres, and I call it my passion project. And it's an equestrian center out in Bearspaw that actually opened a clinic. So they do a lot of volunteer work in the community, and I treat not only equestrian riders, but they kind of just help with everything in terms of child development.
Love
anybody
that.
with PTSD. They have a bunch of psychologists out there that are amazing. So yeah, everyone kind of just comes out if they need some good therapy, and the horses help. So I get to go out, treat patients, and then go riding horses after, which is so nice.
That sounds
how
so
therapeutic.
Fun. Yeah, and so this
fun.
is your passion project. So that's on top of your day job and being a mom and all that.
Yes, yeah.
When do you have time to sleep?
I barely do, you guys. My daughter was sick. I was going on 3 hours sleep a few nights. Oh my gosh, and you just do it. You know what it's like your moms. You just have no choice.
You have no choice.
Yeah, it just never, it doesn't stop. And you had mentioned surrounding yourself with people, with amazing people. It's just funny that you mentioned that, because I play in a women's volleyball league, and all the other females that I play with, one is a chiropractor, one she's an acupuncturist, and what's the other one? Anyways, the other one does massage. And it's funny because every time someone gets injured or someone walks in and they're like, I have this migraine, and she's touching all these pressure points, and I was just I'm never going to let you guys go because this treatment's free. And she's literally doing it for me. But honestly, it's wonderful because all of the like things that they send me, it's like, hey, try this and do this, or come see me, or do you need a requisition? Well, you don't have to wait for your doctor. I'll just send you one. Like, it's freaking amazing. You know how long it takes to get a doctor? And by the way, I'm going on a tangent like I said I was doing. I feel like acupuncture is very underrated and it's not spoken enough of as treatments. And the reason why I say that is a few years ago, I actually snapped something on my shoulder and I ended up having to take cortisone shots. And it took forever and it would go away for 2 months, but then I had to take shots again. And the only thing that helped me was acupuncture. And from time to time, maybe like every 2 years, I just have to go for some brief maintenance because it would come back because it's like bursitis. It's like fluid buildup.
Inflammation.
Yeah, but it would go away. And I was just like, how are we? I feel like sometimes we should find other ways besides getting medicated or try to find a different solution. Like, I don't know why that wasn't even an option given to me at the time, except for, here you go, take some cortisone shots and maybe it'll go away. Like, how do you handle, when people ask you traditional Chinese medicine versus, like getting medication?
Yeah, so that's such a great question. I get it all the time. And I think the biggest thing about traditional Chinese medicine and acupuncture is we're a complementary medicine. So I tell people I'm not your alternative to an MD. I love working with MDs. I think that it's so important to work together as a team.
Yeah.
And I think the more we work together with other practitioners, the more we learn about what they do and the more we can help the patients. So in the end, it just helps that much more. Like sometimes I've had things, where maybe I miss something and an MD will catch it and vice versa. Like I once had a patient and she was misdiagnosed and I thought, oh wait, what about this? I don't think we've checked you for this. Go back to your doctor and ask them. And sure enough, that was correct. So it's nice to work as a team because sometimes we're human and we just make mistakes and we miss things, especially when you're seeing so many patients a day. Like MDs right now are so overwhelmed. Mm-hmm. They have so many patients. They're trying to keep up. The system is a little bit broken. Mm-hmm. So if we can support one another through that, then why not? Because the only people to benefit are the patients. So we need to show up for our patients, right?
Agreed.
So your background is really interesting because you started from psychology. So what made you switch from psychology to acupuncture and then eventually to sports medicine acupuncture?
Oh, such a loaded question. I love it. I'm going to go on a tangent.
Go for it.
When I was about 17, 18, I can't remember, my uncle passed away. My cousin and I are best friends, and it was her dad. And seeing him go through cancer, he was diagnosed and it seemed like within a few months he passed away. He deteriorated quite fast. And I remember just being a young kid watching him deteriorate and thinking, I wish there was something I could do to help. Like, isn't there something more we can do for these people? So fast forward a few years, I remember sitting in a class in my undergrad and they were just talking about, okay, if this happens, you use this medication, and if this diagnosis, then this. And I remember thinking, but what about our overall health? Like, why aren't we talking about exercise? Why aren't we talking about nutrition, about mental well-being, all of these things? And that's when I kind of learned about acupuncture, and I learned that it can help because it searches for the root, not just kind of like what's going on. We dig deep. And then I learned that it can help cancer patients and people going through chemo and radiation and give them support just to feel better, maybe less bone pain through their treatments or help with their nausea. And then I fell in love with it and I thought, oh, this is what I wish my uncle had because I would have been able to help him. So then I just ended up falling in love with it and terrified of needles my whole life. Never wanted anyone to touch me with needles. If someone said I'd be an acupuncturist, like I never would have believed them. I was like, there's no way I'd pay anyone to stick needles in me. But I worked with a lady who did it and she told me, just let me try it on you once. And then I just fell in love. And the more I learned, I just was sold. I was like, this is everything that I've always thought about for health and wellness. And I grew up an athlete. I was a gymnast when I was younger. So we were always kind of talking about health and what our diet is, and we have to eat well and, train well and sleep well. So it was just one of those things that, it just came together. It was something that I fell in love with, and I loved the idea of being able to help people and view the body as a whole instead of just, oh, my shoulder hurts. Let's inject like you just said.
Exactly.
Right? Which can be very helpful at times, but let's back it up with some other stuff, some acupuncture, physio, or anything else, right?
Yeah, because it was crazy. I was just like, I have to go again. And mind you, they numb it, but you can see on the x-ray and the needle's like this big going right through my shoulder. And I was like, and like yourself, I hate needles. So a lot of the time, well, my son, I told him lots of questions too, because he has sports injuries. And I told him, I was like, why don't you come and get some acupuncture with me? But he's like, no, I can't. I've seen those needles on your back or your shoulder. I'm cringing.
Yeah.
Does it hurt?
Such a good question. So it should never hurt or feel uncomfortable. There'll be times where you feel like your muscles, if we're going in and doing what I do motor point needling sometimes. So you go into essentially the highest point of electrical conductivity within the muscle belly. So when you hit that, then it can kind of give that twitch. If you've ever had like needling like that, then that's kind of motor point needling or trigger point needling. Then that you'll feel a little bit and it should release, but nothing should ever be painful. So I always tell my patients, if you have a needle in you and it feels a little bit pinchy or pokey, sometimes it's just a follicle. We'll adjust the needle and it shouldn't hurt. So if people are really like hammering in needles in you and they have like maybe if they're using a thicker gauge needle than I use, I like to use really tiny ones to make my patients feel comfortable within reason. Sometimes I really want them feeling, when we're doing the sports medicine, they're going to feel them for sure. But for the most part, I think it should be comfortable. And I want my patients to leave feeling very relaxed. And, our lives are so busy and so stressful that if we can have that 45 minutes or an hour on the table where we can just decompress, turn off our cell phones. I've literally taken them away from patients' hands before and been like, no, like you are not doing this. I would steal your phone in a heartbeat. Yeah. I'll be like, nope, not in my room. Like I'm ruthless. I'm like, savage, get this out of here. You're here to relax. So yeah, I think it should never be uncomfortable. And there are odd times like you might leave a bit sore and achy after a treatment if we're really working the muscles. But for the most part, if we're doing like fertility work, people just leave and say, I felt maybe if anything a little tired or a little relaxed, but never in pain for sure.
So for our listeners who are like me, I don't really know a lot about acupuncture. Actually, I kind of have PTSD from needles because my anesthesiologist who administered my epidural messed up 3 times.
Oh, my cousin had that happen. It was terrible.
Oh my God. It was worse than the actual C-section because I could feel the needle going into my back like several times. And so now, and then after that, I got into a car accident like a couple years ago, and my physiotherapist was like, well, why don't we try needling? I was like, nope, don't put that near me. And I feel like it just brings back all these memories and stuff. So number one, how does it work? Like, what do the needles do for your muscles? And number 2, how can I get over that?
Yes.
Or people who have a fear of needles in general, how can they get over it to get this?
Okay, so first know that the needles are so small that we use. So they are nothing compared to an epidural needle. I got an epidural and I didn't even look. I was like, nope, not happening. I'm just going to pretend this isn't happening right now because I wanted to do a natural birth. Didn't happen. But anyways, the needles are so small. So some of them are the size of a strand of hair. So they're really, really thin needles. And how it works is essentially we put the needles in different points in the body. So in Chinese medicine, there's a whole bunch of different meridians. So I kind of describe it like different roadways in your body. Imagine like just you're in the city of Calgary, there's all of these different roads, and each road is going to lead to different things. So some of them will lead to different organs. So it's maybe your kidneys, maybe it's your spleen, your stomach, your lungs, all of these things. And essentially what we do is we put these ultra-thin needles into a specific point in the body, and that will elicit a response through the nerves, we say. A lot of it we think just affects the neurotransmitters in the body, which sends a message to the brain saying, hey, in case of muscles, maybe, hey, you're holding me too tight. The muscle will give a little twitch, release, and then relaxes. So it's actually really interesting because Harvard School of Medicine, they just did a study with how acupuncture works, because so many people say, but how does it work or what does it work? I think that's the hardest thing with research. And they just actually found the pathways that these neurotransmitters follow, and they could see them leading, I guess, to different organs. And the organs and the pathways that they were finding were the maps of Chinese medicine from 2,000 years ago when they came out with it.
Crazy.
So it was really cool. So it kind of proved like to people and scientists that say like, hey, we can't really see how it works. So how is this? So now to date, I think there's over 60,000 published articles on like clinical trials with Chinese medicine and acupuncture to show that it does work. So that's kind of, research keeps getting better and stronger, and people are starting to understand it more. So I think that's why MDs are more open to it now than maybe they would have been 20, 30 years ago, because they just didn't know enough about it, especially in Canada and North America. Obviously in China, they've been doing it forever. Overseas, Japanese, like needling techniques a little bit different, but everyone kind of had that and it worked, and they use it in hospitals there. In Canada, we're still so far behind with that.
Do you think that because like in the Asia part of the world, a lot of those people are far more healthier than we are. Do you think that's
longer.
and live longer?
Yeah.
Do you think that's like one of the attributes of why
I think so.
people live longer than us here?
I think it's not only that, but it's the whole lifestyle. Like you have to think of diet, right? So much of the diet is like they're eating so many vegetables, you know, you're doing your soups, you're doing your congees, your bone broths.
Yeah.
They take such great care of postpartum women. Like you're looking at, you know, like sometimes I remember learning in school, like, okay, you're going to have this like blackened chicken broth and you're going to do the postpartum, the placenta pills. Like they were on top of everything. Whereas this is things that we're kind of just learning about in hindsight, maybe 30, 40 years.
That's crazy.
But I just feel like Canada, we're always behind, right? Compared to other places in the world. So I feel like, like even for skin, like God, the beautiful skin. Like I was like, they have the best face masks. And like whenever I want to learn about like acupuncture and acufacials, I'm like, okay, what are they doing in maybe like Korea, or there's always newer techniques to learn from, right? We're just kind of behind here sometimes. I don't know why.
Interesting you said about acupuncture on the face. What is it called again?
Acufacials or
yes, there you go.
lifts. Yeah.
So I got that done because during COVID, I got so much acne and I couldn't sleep. Like my sleep pattern was just all over the place. And somebody had mentioned like, hey, you should try acufacial. And I was like, you can put it on my back, my arm. That is not going on my face. And probably 1 to 2 sessions, I slept like a baby. Like I was like in a deep sleep. And she's like, you were sleeping while I was putting that in your face. And I was like, oh, okay. But also my acne started to subside because it was terrible. And I've never had acne growing up. So can you imagine all of a sudden it's all over your face and you like don't want to go out. So what do you think, like, even when people don't have acne or they couldn't go to sleep, what are the benefits of it just being as facial, and how often should one do it?
Yeah. So I was trained in what's called Mazen facial. So I got trained in Miami for acufacials and facelifts. And what we did with that is we always learned it was a series of 12 treatments. So you have to be consistent, 2 treatments a week for 6 weeks. With that said, in my practice, especially when I'm treating younger women or men, because I do a lot of acufacials on men as well, I've learned that sometimes it just doesn't need to be that many treatments. Like you said, like sometimes the skin will clear up pretty fast. So if it's not for acne and just overall health, what we try to focus on is boosting collagen and elastin production in the face. So sometimes we do obviously points on the face, but then I'll also do whole body treatments. So you still get the points for insomnia, like you mentioned, or points on your hands, your legs, what else is going on. So much of what's going on, especially with breakouts or anything else.
Can you check if it's plugged in properly? Can you jiggle this cord right here, Amanda?
Yep. Oh, it did it.
There you go.
There you go.
Yeah.
Thanks.
It's
Sorry,
brilliant.
guys.
All good.
So much of it is just kind of like using your body and your health. So what's going on in your gut, for example, like your gut health can relate to your skin, of course. And in Chinese medicine, that's the lung meridian sometimes too for the skin. So we'll see like, oh, okay, what else is going on here? Are there any other issues? If you're having eczema, what's going on in your body? Why are we having allergies? Like all of these things, it's the body as a whole. How is it working? Where is this in the system essentially? What's kind of compromised? What do we need to fix? What do we need to balance out?
So I know that you specialize in sports medicine acupuncture, but is that something that you offer? Is the acufacials as well?
Yeah. So my practice is really well-rounded, actually. Like I always say, I kind of feel like my uncle's a GP, so he'd probably laugh when I say this, but I kind of feel like a GP in the sense, sometimes in terms of what I see for patients. So yes, I do the acufacials. Yes, I do the sports medicine. But I do a lot of my practices fertility based as well, and reproductive health and men's health as well. A lot of it is stress, depression, anxiety, insomnia. This year I have so many peds patients, which I never had before, for building immune systems because post-COVID, kids are really struggling. They're going back to school. They are catching everything and anything because they haven't been exposed to much. So So this year I'm treating more peds patients than I'd say I have probably the last 8 years combined. But
Wow.
I like it because it's a different part of my practice, and they're so cute. They come in and sometimes they're terrified, and then we talk them through it, and we just kind of work together. And if it's one needle I put in, it's one, and maybe it's not a needle, maybe it's cupping that day, or we do other techniques called gua sha, which is a little tool on the skin.
Yes.
Yeah.
There's so many cool things we can do. So I do acupressure. If they're nervous, we can start with acupressure, acutonics. It's vibration therapy through tuning forks. So I do that as well. And I like to use those mostly on kids, and then like kind of like geriatrics, like my older patients, if their bodies are a little, we call chi deficient, where their energy is just a bit maybe depleted. Then I can get in and use those, and it's just a gentler form of treatment, and it's great for people that have a needle phobia. So like it's great to ease people in that are maybe like, I don't want a needle near me. Well, that's okay, because there's so many different things we can do for you to help.
That's so interesting, because like when I take my daughter for her yearly flu shot, it's a nightmare, and it's gotten worse as she got older, because she knows what's going on. She knows what's going to happen. So like, I'm like, oh my God, I don't know if I would ever get her on the boat for that, but that is interesting.
Yeah, and it's just doing little things, like start them off with cupping. And I always joke, I say, I'm supercharging you. Like I have one little patient, and I say, oh, this is your supercharge. What's your favorite superhero? Okay, it's the Hulk.
Nice.
Okay, perfect. We're gonna put this in, and it's gonna make your muscles big like the Hulk. And like we just joke around, and then I'll pretend that his muscles get bigger, and just play around with it, right? To make them feel comfortable.
Yeah.
Because I always say, I'm like, I'm not putting a needle in it somebody that doesn't want one. Like, I will not traumatize your child. So if you're thinking I'm going to force one on, nope, not happening. Like, I'll send you to somebody else that might be able to do it. I'm too much of an empath. There's no way I can do it.
That was actually my next question. Actually, I have a couple. So what is the youngest patient? Because I was going to say, at what age could you do acupuncture? And second, people think acupuncture is just needles. Actually, I didn't know that until my own doctor, therapist.
This is news to me, guys.
Yeah.
Yeah.
So she did cupping, and I was like, first of all, my mom cups her own freaking back. Like since I was young, I didn't even know that was a form of acupuncture.
Oh.
Yeah, and then she like did this like electric thing. I don't know what she was doing, because she's like, you know what, you're so tight. I can't. Like you're twitching everywhere. She's like, you're just sensitive. So she was like doing different methods, and I'm like, this is acupuncture still? She's like, yeah, it's just a different method. I like had no freaking idea.
Yeah. So it's all traditional Chinese medicine. So what we do is like cupping is a part of it. And now I kind of laugh because cupping is everywhere. Like everyone's cupping, chiros are cupping, physio's cupping. I'm like, yeah, that's a Chinese medicine thing. We've been doing that. They've been doing that for years. Like you guys are behind on your times. And so many times when people joke like, oh, Chinese medicine, does it work? I'm like, well, clearly, because now everyone's doing it. So in terms of like gua sha, like the scraping tool, so that's used, especially like if kids are just getting colds or flus, then we do different techniques on the back to help bring it out. So that I know a lot of people that had that done as kids, and they're like, I don't know what my parents were doing on me. And I'm like, oh, that was gua sha. And that's why you had like this little tool on your back.
Cool.
So yeah, there's so many different components to it. Dietary therapy is a huge component. So talking to people about what kind of foods they should put into their body depending on their constitution. So for some people, I think I had a bodybuilder once, and he came in, and we look at tongue and pulse to diagnose, and his tongue was super red. So we're like, oh, internal heat, like it's like a little fire. And I was like, oh, no spicy food for you. He's like, Amanda, I hate you. No spicy food. I'm like, okay, give me 2 weeks. Get rid of the spicy food for 2 weeks. And if you don't feel better, then you can yell at me. You can do whatever you want. And he came back 2 weeks later. He's like, oh, I hate you even more now because it worked. I'm feeling way better. And I was like, well, this is because your constitution is like screaming fire, and you're like adding hot sauce to just making it get so much worse. So it's just really looking at that person's body, and every treatment is tailored to the individual. There's not one treatment for, for example, diabetes. There's not one treatment we're doing for that person. Every body is so different and so unique. So I'm really thorough in my examinations to the point I probably annoy my patients because they ask a million questions. Like I want to know every single system, how everything's working, be thorough on my intake. So I know like, okay, this is kind of where we're going with our treatment plan and how we can help you.
And Har and I were actually talking about like how our menstrual cycles like make us a little bit psycho.
Yep.
Maybe not a little bit, maybe a little more than a little bit. But, we'd always just joke around about how like our mood swings are just so up and down. And like, one day in your cycle, you're just like, oh, I don't want to get out of bed. And then, it's just so drastic for women. And you were talking about how like every muscle is like a meridian to different parts of the body. So in terms of like menstrual cycles, how do you help women get over like period symptoms, the cramps, the mood swings, and all of that, because that's something that her and I are always bitching about, I feel like.
I hate periods.
It's the worst. So many people see me once a month for the week before. So in terms of TCM and acupuncture, what we can do for like periods in general is if people are having really like horribly painful periods, we call it like dysmenorrhea. They're just painful cramps, just not feeling good. So a lot of what we do is just do gentle acupuncture points on the tummy, and we regulate the hormones. So a lot of it will just be working with hormones in your body to say like, okay, this is why the body is maybe doing this. Or in terms of cramping and the pain and the mood swings, we call it stagnation in Chinese medicine. So the period pain would be like blood stagnation, which means your blood's just not flowing that smoothly. So sometimes we just do different things to help stimulate that blood flow, which eases up the period pain. And then in terms of like the irritable, the PMS symptoms, we call it sometimes liver qi stagnation. So it doesn't mean anything's wrong with your liver. It just, that's the energetics of the component, and the liver pathway runs through your reproductive organs, putting it kind of simply. But yeah, so we work to do lots of liver points, which can clear stagnation. So sometimes I tell people when they first start working on you, you know, maybe you'll be a little grumpy because we're going to bring out these emotions. So if you've been holding on to a lot, or you're just a mom that is stressed out, then we're going to bring it out, and like you'll feel so much more relaxed after. And I've treated people for postpartum rage before. It's a very real thing. And women have come in crying and just saying like, I don't know what is wrong with me. I'm snapping. I'm more irritable. I'm like, this is just your body. We just need to reset it and work with sometimes your parasympathetic nervous system, calm everything down, and then you'll just feel so much better. So so those cranky episodes we can deal with. You guys, we should do like a double treatment. The one day we'll have you each on a bed. And
Can we?
Oh my God,
we'll stream it live. But the most important question is, can you treat the cravings before the period? That
we do.
Oh my God.
It's a thing. And we actually do acupuncture for weight loss too.
Okay, so how many needles? Let's do this right now. Do you have it on me? Let's go.
Poke me, doctor.
Let's put them in. No, we do. And sometimes even auricular acupuncture, so needles in your ear, can work for cravings. So we use that for like weight loss and cravings as well. But once, it's the same thing. Once we're able to kind of balance out those hormones, and you don't have those excessive cravings because your body's getting what it needs. So it's not having like, for example, some people, if they're craving sugar, we say like spleen, stomach in Chinese medicine, like, is there some sort of disbalance, or like, is it something like candida in your body where it's just craving the sugar, it's feeding off of the sugar? So
when's your next opening?
After I get back from my trip, I'm leaving. Girls trip this weekend. You're going to have to wait.
It's okay. We'll prepare our bodies for all the cakes that we're about to eat, because you're going to take all the toxins out.
So, because you were saying that people often see you like a week before their periods, but when it comes to like regulating hormones, like, because obviously your hormones are always up and down no matter what part of the cycle you're in, how often do people have to see you in order for it to be regulated? Like, do they just see you once and then they leave feeling better, and then once the symptoms come back, do they see you again, or is it a regular thing?
So it's a pretty regular thing in terms of, especially at the beginning. So I always say acupuncture is kind of like a dose of like medicine. If you were to take one antibiotic instead of your whole series of treatments or your whole course of treatment, it's not going to get rid of the bacteria. And acupuncture is the same. So if you have like 10 years of hormone imbalances or not getting a period due to so many different things, then it's going to take some time to regulate that. So sometimes we use herbs as well. We'll use different herbal formulas to regulate. Sometimes we will use just the needles alone. But I always tell people when I first start treating them, and other acus might have a totally different view, which I think is so cool about our profession. Everyone has their own ways, but I like to say twice a week for 2 weeks. And then we just see how they're feeling. And I tell people, like, see how you're feeling, go on your way, maybe come back the following month, right before your period comes or during, and then we can help to regulate, and then we go from there. So a lot of people do maintenance every 4 to 6 weeks, but it really depends on the person. It's just such a loaded question because, like I said, if you haven't had a period in 10 years, then we're going to try to get a period. So that's going to take a little bit longer. Whereas if you have a cycle that is really regular, maybe every 28 days, you know your period's coming, then it's a lot easier to help regulate that and just get everything kind of straightened out.
So how does your acupuncture relate to, like, let's say, for example, a woman is on birth control, and obviously there's so many different kinds of birth control. There's the low hormone ones, there's like the IUDs, and they're all so different. So does that kind of affect what you will do for the patient depending on like what they're on?
Yeah, for sure. Because sometimes obviously they might not know if they're on like an IUD, they might not know when their cycles are. So in Chinese medicine, we view a lot of like birth control and anything that's suppressing the hormones, changing the hormones, as it creates stagnation in the body, because the body's essentially not doing what it's made to do. Like our bodies naturally are not meant to have external hormones. So we just kind of work with what people are doing. It's no different than if people are on any other medication that's maybe they're on medication that's giving them dry mouth or, you know, other symptoms. Like some people start antidepressants and they start getting headaches. So, okay, let's treat the headaches and let's go from there. So it's kind of just assessing where the patient is at and working with what they have, because some hormones are higher, or sorry, some birth control pills are higher in hormones than others, right? So if it's like an IUD versus like, you know, a birth control pill 25 years ago that would have been a way higher dose, then that would have been problematic. Or even back then there was really bad pills I always warn my patients, like this one birth control pill, which I probably can't say because you never know with pharmaceutical companies, but it's significantly increased breast cancer in patients because of the higher estrogen component. So a lot of my patients that I'm seeing, young 30-year-old women right now with breast cancer, they were all on that pill. So it's just kind of like, I think even now I kind of preach almost to people, like if we cannot put teenagers on birth control pill right away, because so many times doctors will be like, hey, you have acne, let's do this, or hey, you have, you know, terrible periods, let's put you on this. But if we can kind of just wait and actually regulate and work with the body, then it's so much healthier. Unless they actually need the birth control pill, then of course, like, we're not against it. I would never say no, don't do it, but it's what works for the patient. And then as ACUs, we just help the patient and support them however we can, essentially.
I'm glad you said that, because now it gives moms like another avenue to go to rather than that. Because, well, when we were growing up, you tell your parents you want to go on birth control. It's like, no, you're having sex, you know?
Yeah,
like,
that's a thing.
That's a thing.
Yeah, for
right?
sure.
So that's great to know, and like a great tip for
and even for menopause. Like so many people think that they have to take all these external hormones for menopause, or they're taking a million supplements, and they come in, I'm like, oh, it's night sweats. Okay, let's just treat your night sweats, or you're having hot flashes. Let's do that.
That was literally my next question.
Thing. Yeah.
about menopause.
I was like,
she's already ready for menopause. You're too young.
I was like, let's talk about our period slam menopause. So what happens now? Just so I can feel it. First of all, I always joke about how I was like, fuck my periods, I can't wait to go on menopause. And then people are like, you're crazy. I don't know if I, like, people give me horrible stories about it. So now I'm just like deathly afraid of, like, because I'm always cold. I even walked in here and I was like, I'm freezing. I don't want to take my jacket off. Like, am I like just gonna sweat all day long? Like,
why don't you tell Amanda and everyone listening what your heat is set at all the time in your home?
Okay, so in my house, it's constantly at 22 degrees. But most of the time it's 24 because I like to keep it at 24. And then when I go away for work and traveling, and it just depends what I'm doing, I crank it to 26 degrees and I'm like nice and toasty warm.
Oh my gosh, my husband would murder me.
I was like, I would get in so much shit.
Anytime I touch that thermostat, he's like, babe, did you? I'm like, maybe just a little.
Is that a men
thing?
thing?
Now he's so wonderful.
Because my boyfriend, every time, I don't touch his thermostat. I made that mistake at his house. So, and every time I don't know, because he has baseboard heating because he's in like a apartment. And I didn't touch anything and it was kind of hot. And he's like, did you touch a thermostat? I'm like, no, I didn't. He's like, are you sure? I was like, why would I lie about
it? Is the battle of sexes.
Yeah,
it's the battle of sexes. Any relationship, it's the thermostat.
It's the thermostat.
It's the thermostat.
I've given up. He sets it better than me. He knows how to regulate it better. I'm terrible.
So now he just tosses the blanket and he's like, if you're cold, just put this on. It's fine. Because if you're hot, you could just take it off. It's like, it's going to take forever to regulate this fucking thermostat because you just changed it. But anyways, I'm the queen of my house right now. So I don't care if anyone's hot because I pay the bills. So you guys can all cook because it's going to stay at 22 to 24 degrees.
I love that. Okay, we can do hot yoga. She'll crank it up.
Right.
We can go over and do hot yoga in her house.
Feels
it's going to be awesome.
I love it. I love it. And then it gets hot and I like one toe's just sticking out of my like comforter. I was like, I'm nice and cool.
Oh my God.
So
Girl.
funny.
Sorry, you were talking about menopause.
Yes. So, so with menopause, there's all these different things. Like, what part of the body do you use for acupuncture? Is it just needles, or are you cupping? Like, what are you like
so
to helping them?
sometimes it can be a bit of both, but for the most part, I love like acupuncture and herbs for that. In menopause, we call it like kidney yin declining. Yin is kind of like our body fluids. Like our yin is like our kind of like our blood and everything moving, and we kind of decline in that as we get older. So it's really comes down to just nourishing the body and reinforcing our yin, and then that in turn helps with the hormones, the blood circulation, all of that stuff. So the sweating, if it's excessive, sometimes it's because our yin is so deficient that our body kind of swings this opposite way and is like, I don't know what to do. So you get sometimes like sweating on the chest or the hands, the face. Yeah, it can be terrible. My menopausal patients have really made me nervous for menopause. I was like, you guys are scaring me. This is what I have to look forward to as they come in. And just, oh my gosh. Yeah.
I think that just the problems never stop as a woman.
Yeah. And it's just and women are so completely different. I mean, we talk about this all the time on our podcast where, you know, you have some women that's like, I loved every part of pregnancy. I was like, are you fucking kidding me? I love my son to death and I will do it again. But I had the worst, like from start to finish when it comes to like, you know, my pregnancy. Anything that went wrong did go wrong.
Yeah.
But I mean, it's a far distant now. And here I am talking about like, hey, I'm going to do it all over again, you know?
We'll support you this time. We'll support you through it. I remember having the worst leg cramps during pregnancy, and my husband, I literally wake up screaming in the night. I'm like, my leg. And the one time my husband looked and he's like, this thing's going to like burst out of, like, is your calf going to come out of your leg? And I was like, massage. And it was so terrible. And I'm like taking all this magnesium, doing everything I can. I'm like, oh, this pregnancy sucks. But same thing, like I have patients that come in and like, they look amazing. Like they're so healthy. Like I feel the best I've ever felt. And I'm so happy for them. Like,
yeah, me too.
This is awesome. Like I want this for myself too. Yeah. Like I wish, but it's cool. It's cool to support people through their pregnancies.
So having said that then, is it a different process for pregnancies? Like for pregnant women, like, you know how, well, for pregnant women, there's always modifications to everything. So is it the same process for pregnant women? Like, is there any harm in it or complications?
Yeah. So no harm. There's obviously, if you are pregnant, there's certain points we would always avoid needling. So we'll avoid those points, but leading up to it, it's so great for fertility. So in terms of like regulating periods, helping people with things like PCOS, endometriosis, people that don't get a period or are anovulatory, so they're just not ovulating, then it can actually help with all of that stuff. And there's actually a really cool study done in terms of even patients needing IVF. So I do a lot of work with patients that are going to the fertility clinic as well. And the study was done and it showed that if you were using acupuncture while going through your treatments, it increased success of viable pregnancy by 42%.
Wow.
So
that's
there's
high.
different protocols we use. Yeah. So it's an amazing supportive tool while you're going through your treatments. And on top of that, it's just great for the stress because when you're given like, sometimes people are on like Clomid, letrozole, they're on these medications and then they feel maybe a bit anxious on them, which is perfectly normal because you're given hormones. I always say like, you know, guys on steroids, they're a little grumpy, they're a little cranky sometimes, right? So when we're giving women all these hormones, of course there's going to be emotions that come along with it. So it's helping support them through that process because that process is so challenging. It's mentally draining. It's physically exhausting. So I think it's just how else can we support them? So if we can also do acupuncture to decrease their cortisol levels, help that, then, you know, that's just making them feel better in the long run. And it's also helping fertility too, because they're not as stressed, so they're more easily able to get pregnant.
So does that mean your process then, like the acupuncture is on top of when women go to the fertility clinic, or can they just skip that and go straight into acupuncture?
Yeah, so they can go straight into acupuncture for sure. So acupuncture actually helps to improve ovarian function. So we help to increase the FSH levels and LH levels naturally throughout the cycle. So we'll treat during different stages of the cycle. So whether you're in your follicular cycle, your luteal phase, there's just so like, or just the menstrual cycle days 1 to 7, people can come in. And then I normally tell people come in pre-ovulation and post-ovulation as well. The last few years I've been treating more males for fertility as well, because sometimes people always think, oh, it's the woman, like let's get, and women come in and their husband's sperm hasn't even been checked yet. So they haven't done a semen analysis. So with that said, men's sperm has declined, I think it's 33%. They did a study in France and it had declined by at least 30% for motility, mobility, overall, just kind of like overall sperm count in general.
30%. I'm going to go home
Yeah.
and I'm going to
So,
say
like,
that. I'll be like,
What is the reason for that?
Yeah,
They-
why?
So that one is, there's so many, it's such a loaded question, but environmental toxins can be a huge thing. So there's things that like just your phthalates can do it. So different things that you're exposed to. So plastics, pesticides on foods has an anti-androgen effect. So that can affect it. And then it affects spermatogenesis. So how the sperm is being kind of like transformed and made and the whole process of the sperm motility. So there's different things that really kill sperm count. So if you're trying to get pregnant, you'd want to avoid those. So smoking obviously is like brutal for the sperm. Cannabis is really, really bad for sperm as well. And the reason for that is because your sperm has to swim, obviously, to get to the egg, right?
Yeah.
To match, to reproduce. So what happens is if people are smoking cannabis, the sperm doesn't know which way to swim.
It's high.
They're kind of high. And they go in 60-day cycles. So I tell people, I'm like, your sperm is roughly about a 60-day cycle, I guess, in the making, if you will. And I'm probably wording this terribly for all you MDs out there. You're probably cringing at me, trying to kind of like simplify things. But the cannabis can affect that because it's essentially the motility isn't there. It's not swimming as effectively. There was one study done and it was swimming the opposite direction.
Oh my God.
It said something like that. Like they call them twitchers. So they just kind of sit there and they're wiggling, but they're not actually doing their job and going to where they need to be.
it's literally high.
So funny.
So
Stone
don't
sperm.
smoke weed or, no cannabis if you're trying to get pregnant. And definitely like avoid the pesticides on food because they think that's a huge component of it as well. Because that obviously can just kind of affect everything, our hormones, how our body's producing things. The environmental toxins can cause even like different genetic defects in kids and our health, like cancer, so many other things, right?
Mm-hmm.
It's not by age. Like, Giselle we were talking about the Oscars and like how, what was her name again?
Michelle Yeoh,
sorry. That, you're not in your prime because mostly a lot of people are like, oh, you're no longer in your prime and you have babies at this age. Does it affect men and their like the reduction of their sperm count as well as when of their age? Just because for women like us, our eggs are less. Our
we slowly
follicles.
decline, especially after 35. Our follicles maybe aren't as great, so that's when it's good to get follicle testing. Like there's so many different tests that we can do in terms of fertility. But with men, there was once a study done and it was talking about how men over 40 can have higher chances of having like kind of like schizophrenia in their babies and stuff like that. So I think that with time, obviously maybe their sperm does change and their genetics will change, but they won't be as strong maybe.
Yeah.
But I think for men, they definitely don't have that time sensitivity that we do where we know that, okay, our eggs are slowly diminishing and we're not kind of releasing as many. We don't have as many follicles maybe each month. That will decline as well. So I think men are just luckier in that sense. But with that said, they still have to be on top of things like for men, sperm killers like going in hot tubs, like the heat, the saunas, all of that, because they have to make sure that their testicles are kept a little bit cooler in order for the sperm to be healthy and survive, right? So I always say no heated seats if you're trying to get pregnant. If you're a man, it's your duty to help out too. It's not all the women. So no heated seats, no hot tubs. Cell phones in pockets are also a no-no because of they think that even though you can't feel the heat of the phone, there's been studies that show actually, it does maybe affect that. So none of that as well. And then obviously diet and exercise plays a huge component in it as well. So I always say if you're trying to get pregnant, like you're training for a marathon, not only the labor, but raising kids. Like you guys know what it's like it's just it's not easy. You're always on the go. You need to be in the best shape of your life, physically, mentally, picking them up, all of these things. So that is not only great for fertility, getting in shape and exercising regularly, which is huge for fertility as long as we're not overdoing it. Like if you're trying to get pregnant, don't go run a marathon. It's going to deplete your body maybe a bit more than it needs to be, but everything in moderation. And when it comes to exercise, they say anywhere between 30 to 50 minutes a day of gentle exercise to help improve fertility for males and females. So I think it is really important for just everyone to know it's not just always the woman that has to be kind of taking care of her body, right?
So this reminds me of, do you watch Keeping Up with the Kardashians?
I haven't seen it in years, but I have watched a few episodes.
Well, I know
for sure.
you do.
I used to watch it. It was my mindless TV.
That's my mindless TV
guilty
too.
pleasure
Yeah.
when I'm just home alone and folding laundry or whatever. But it just brings me back to when Courtney and Travis were trying, remember? And they were going through like these really crazy diets and like just everything was so extreme, and everyone was kind of laughing and saying like, well, you don't need to do that or whatever. Didn't she say something like, oh, do I need to drink his sperm or something?
Yeah, I don't know.
Stupid.
It was
Oh my
weird. I was like,
gosh.
ugh.
Like
I mean, it could work. Whatever. If you would, I probably would do too.
Well, yeah, like I don't know anything about it, so I was like, does this actually work? Like,
she's paying lots of money, so
yeah.
Well, no, yeah, you don't need to drink the sperm. Okay, let's just throw that out the window. That's definitely
because by the time the sperm gets into my mouth, that spermage is
my
like dead
gosh.
by now. It wouldn't it be? I don't know.
That's not gonna do you any good. Just throw it out the window. Throw that one out. There's a lot of guys that are like, yes, you do need to drink my sperm right now. I know they're just like the husbands are just like, let's go.
Yeah.
But no, diet plays a huge role in fertility. So do you want me to give a few like pointers or tips?
Yeah, absolutely.
So first, healthy weight. So healthy weight, obviously, people go by BMI. I don't think people should go by BMI as much. It's kind of old school technique, throwing it out. So I was talking to a nutrition about this. Mel Cronjar, she's amazing. I love her. And she was telling me the string method. She's like, we use the string method. So you take a string, you measure from the ground your height, and then you fold that string in half and you put it around your waist. And your waist needs to ideally be able to fit around the half of that length of the string. And if you're over that, then it's saying that your visceral fat is a little bit higher, which makes it more difficult to get pregnant. And on not only that,
Do you have a string?
I feel like
I need to know right now.
I'm curious too. But if you are obese or have extra weight, then not only does it make it more difficult for fertility, but your child's 5 times more likely to have health issues if you're overweight when you're trying to get pregnant. So some people don't think of that as well. So I think it's just being healthy and keeping in mind that visceral fat can really impact the inflammation in your body and cardiovascular disease, all of these things. So we always talk about like how is your visceral fat around your belly? Like belly fat is the dangerous fat to have. So, everyone wants big booties these days. That's fine. The booty's we're not as worried maybe about the booty, but it's that visceral fat on your stomach that is a concern because it's showing a lot of inflammation, is putting you higher risk for so many different diseases. So keep in mind the healthy body weight is huge for fertility. Anti-inflammatory diets. I don't know if you guys have heard of those before, but it's essentially just kind of cutting out the crap, like no sugars, no alcohol, sometimes low GI, incorporating more fruits, vegetables. You get the antioxidant support with them. So when you're trying to get pregnant, you really want to load up on antioxidant foods. So a lot of the time that's your raspberries, your berries. I love goji berries, Chinese medicine. We love them. As well, flax seeds, walnuts, chia seeds for omega-3. Omega-3 is really important. Zinc is more for men. So zinc can be a helpful supplement to take for men. And then egg yolks have choline in it. So choline is really great as well. Helps with DNA, metabolizes the hormones, helps produce neurotransmitters. And then you can also find in eggs, fish, meat, certain vegetables. But yeah, there's just a few things. Like I always tell my patients, load up on fruits and veggies. But as a traditional Chinese medicine practitioner, we want to avoid cold, raw foods. So we hate the cold for the Chinese medicine. We want to bring warmth to the uterus to make it like a happy, healthy place for baby making, right? For your eggs, we want to keep them warm. So I always tell people lots of cinnamon, ginger teas are really great. Even at the beginning of pregnancy, if you're feeling nauseous, then ginger teas are so good too. So yeah.
So what about is there anything extra you do for women who are over 40? Because I know that it's the chances of them to be, conceive is pretty low. I mean, it's not that it's not going to happen, but is there any other things that you guys do aside from everything else that you've just listed out?
Yeah, so I definitely think the egg support is huge. So doing the acupuncture to help with the egg support. I always tell my patients, even anybody that's struggling with fertility, or if you're, over 35, it's really great to go get the labs done. So your doctor can run different things. So they want to test your hormones. So LH, FSH levels, your ovarian reserve. They can check your follicle counts. Sometimes they'll check and just see your estrogen levels, prolactin levels. That's all really important because then we know what we're working with. So essentially, if you go and get your tests and there's not really any follicles left, then obviously we know that acupuncture probably won't do that much to change it. If you do have some follicles, then it's perfect. Let's strengthen these. Let's keep working this. Let's build your FSH levels. Let's work with that. But I think it's more just I like the blood work. I'm somebody that still has that Western medicine mindset where let's do the labs. Let's work with your doctor. Let's work with your OB and let's see where you're sitting at. But I don't think that it is hopeless. it's so many people say, oh, like I'm 40, but I know so many pregnant women that are 40 and that got pregnant with no trouble at all. I know people that are 25 that are struggling trying to get pregnant. So I'm not so sold. Like obviously your odds decrease. That's kind of, I think most people kind of know that as we get older, our egg reserve declines and the quality of our eggs makes it a little bit more challenging to carry a baby to term sometimes. But I think that overall, it's just see where you're at, see where your hormones are at. If you're somebody that's lived a super healthy life, then maybe your eggs are still great. So why not get them tested to see, right? I always say nothing's hopeless. I just hate that. Sometimes I'll have people come in, they'll say, oh, I was told I can never get pregnant. And I'm like, well, is it anatomical or what are we working with here? Because then sometimes I work with them for a few months and they are pregnant. I'm like, oh, wow. Whoever told you that, I bet you want to go back with your baby and say hi.
Here's my baby.
And it's just, I think that weighs on the psyche so much. So I don't like when people, unless there's something, obviously doctors have to do their job and they have to tell patients what they're finding. But I think that sometimes we really need to work as all of us as a team with our bedside manners, and just so much of it is helping patients support them through it, because if they give up, it doesn't matter if it's on fertility or if they have cancer and they're told they have a few months to live, that weighs on your psyche and it's so hard. So what can we do to better support patients in general?
It's like what everyone says, that how like if they're trying to get pregnant, once they stop trying, that's when it happens because they're so stressed. So having said that, should we go to the viewer question?
Yes.
Okay, so this is from one of our viewers. She says, struggled with conceiving our first child. After finally getting pregnant and giving birth to our beautiful baby, everyone would tell me it would be easier conceiving your second baby now. How could anyone possibly know this about my body? But it actually did happen after our first try. What gives?
Oh, that's a great question. So it actually is a question that I also ask, what gives? Was it luck the first try? Maybe. Some people, your body does... Once it is pregnant, it does typically get pregnant more easily again. But with that said, for people that miscarry, sometimes, it still is hard. They always say if you miscarry, I remember I've had a miscarriage, so I'll talk openly about this. I've actually had 3. So my first miscarriage was before my daughter was born. And I remember my midwives, they were so wonderful and supportive. And I remember them saying like, you know what, try again the next month if you're up for it, because your body's more likely to get pregnant again because it loves being pregnant. It kind of knows how to get pregnant now. So it might be a bit easier. So scientifically, I'm not sure, because I honestly couldn't tell you the research and the data on that. And if I want to answer a question correctly. So I would say I'm not 100% sure on that, but I do know that, my midwives did talk to me about that too. And I think because our body, it knows how to get pregnant. So it's maybe more easy to do it again.
Okay.
Yeah.
Interesting. Okay. We have another viewer question where it's, what are the success rates using acupuncture for those TCC? How often do you need to go?
Okay. So the how often question definitely depends on the person and their constitution and what's going on in their body. But I think success rates in terms of, like kind of even with the IVF, we already talked about like 42%. I don't know the exact stat for the other stuff, but it definitely increases your chances, just because it does, in studies and research has shown time and time again that it does help support egg quality, which in turn helps with fertility. Yeah. Okay. I hope that's helpful. If not, email me. I'll try to answer you better questions.
Don't forget to email her. We'll put all
her
information there.
Yeah, reach out. I love chatting and I love good questions. If I don't know the answer, I'm definitely going to dig for you. I'll get on the phone.
Awesome.
I have a few friends. My friend, even Dr. Anthony Cook, he's a urologist, and I was picking his brain today. I'm like, what is a urologist's perspective on fertility? And so it's good. Yeah,
shout out.
Awesome. Thanks for helping me out.
That's super awesome.
This is a good question for those of us who live in Calgary and experience Chinooks. Does acupuncture help with migraines and sinus headaches?
Absolutely, it does. And it is one of, I shouldn't say my favorite things to treat, because I actually really like treating everything. But I love migraines because patients come in and they're in so much pain and we can help so much. So I once had a patient and she was on, I think it was a list of like 22 medications, and we had her down to 2 with her doctor after like a couple months. So it's really cool what we can do for that. And sometimes it depends like what is causing your migraines or headaches. Like if they're occipital headaches, are they tension headaches? Are they hormonal headaches? That's kind of what we need to dive into with the patient. But once we kind of figure that out in the initial assessment, then it's just, that's how we just treat accordingly. And it's just, I don't want to say an easy fix, but gosh, it works so well that I love when people come in. I'm like, I can't wait to make you feel better. I get so excited, right? And same with fertility. I can't wait. I love helping them on their journey, and I get so excited when they're pregnant, and it's just the best part of my job.
Yeah.
Like when you get that email that's like, oh, don't need to come back. Thanks. Having a
pregnant.
baby. Send
That
ultrasound.
must be such a great feeling. No wonder you love what you do.
Oh, I love it. It's so cool. It's just,
Yeah.
it's the best feeling in the world to be able to support people on their journey, whatever their health is. I feel so blessed. I learn so much from my patients every day. I'm really lucky.
Yeah, and you've had such a wide spectrum of what you've studied too. So you can probably connect all of those things and things just start to be more clear, right?
For sure. I know it's very random. Hey, it's like sports medicine. Wait, I do fertility. Like it's
psychology.
So, I think it's just my brain. I love to learn. Like I had a patient I hadn't seen in a while and he just came and he's like, so what are you studying now? Like he was so intrigued. And I was like, actually Indigenous studies, totally off. But I love learning.
That's
so
amazing.
Always engage in something, right?
So a lot of the other questions here is literally we covered it through the whole thing. But I do have a question for you. My son recently, or probably 3 years ago, got recently diagnosed with what they call CAPS. It's cryoprin associated syndrome. Okay. So it's a genetics disorder. Yeah. I'm actually the carrier because I've been carrying it and I've been going through it since childhood, and all of my son went through the brunt of the whole thing, and that's how we found out. Yeah. So he has treatments and he flares up and he has inflammation like crazy when the weather, like even a slight on your skin, it's just like you get hives and there's inflammation. Yeah. It's really rare, so no one really knows more.
I was going to say, I haven't even heard of it, so I'm not going to pretend to know
yeah,
it. I have
so
no idea,
I mean, I'm
but
sure,
now intrigued and
yeah.
look.
So there's people that have inflammation that you probably treat. I'm curious if that's something that would alleviate, because right now my son hasn't had it in 2 years because of this medication he's had, but there's so much red tape right now on like medication so I'm waiting for it still. And I was like, we literally have the same thing. So they're like giving me all these different medication that I know doesn't work, and I tried it doesn't work, but they're obviously trying to give me something less expensive because this is his medication's like $100,000 a year.
Oh my gosh, it's insane what they charge for medication. Don't get me started. I'm like, why can't we just help people? Like, come on.
That's another topic. For
it is. It's another day.
So, do you think that with the inflammation, like, would acupuncture actually help? Because that's something that I'm trying to explore right now. Because I can get triggered. Like, if I walk out of the studio right now and because my small part of my skin's exposed and it's really cold, it will take like 30 minutes and my joints will start like, it's like, it's like, Wizard of Oz. So is that something that you could help with maybe maintenance with it? Like, I don't know, maybe the day after that it happens, because usually it takes about 3 days for it to subside. I guess maybe you couldn't because you didn't know so much more about it. But.
Well, I think in terms of inflammation, then yeah, of course we can definitely help with that, because we do treat so many different autoimmune diseases and inflammatory responses, RA, like rheumatoid arthritis, just so many things. So absolutely. But I think it would be more like what I would always do is same thing that I tell all my patients, like twice a week, 2 weeks, let's look at all of your patterns in your body and any symptoms that you might have, your gut health. Let's see, like I always tell people, like, tell me about your digestion, tell me about your bowel movements. So we really dive in. And then from there, we'll see what are the patterns. And then in traditional Chinese medicine, it doesn't really matter what syndrome, Western medicine wise, you've been diagnosed with, because we look at patterns within the body to find out, like, is yang in excess, is yin in excess, is there heat in your body? Is there, we call it cold, is there damp? There's so many different symptoms that we look for. Is there blood deficiency or qi? Does not mean you don't have enough blood. It's just more, it's not, it's a little bit maybe diminished. It's not circulating as well. We're a little depleted. So we need to boost your body. So a lot of the times we'll just boost your body, and then that helps with the inflammation. So yeah, I think in terms of comparing it to other inflammatory and autoimmune stuff, for sure it would help. And then you'd kind of be on a maintenance plan after that. So maybe every, like once in a while pop in. If you feel like, okay, I know I'm exposed or I know I'm having a flare up, then come in. It would be no different than my Crohn's patients or colitis patients that are coming in, or my MS patients that are having a flare up. And then they're saying, okay, I'm having a flare up, let's target this and we'll tackle it together. Yeah. And obviously so much of inflammatory response, we can address diet too, because diet, it plays such a huge role in our health. Like nutrition is everything. What we put into our body is ultimately what we get out too. So if we can better support it through that, then it would help for sure. And herbs can be great. So we'd have to see what was going on.
So what about, we talk a lot about the health and wellness aspect about it, but what about like addictions, like smoking and drinking? Like, do you also play a part in trying to treat those things?
We do. So it's actually interesting. So in my studies, when I was going to school, we actually had, it was the best school. They had a program that was out of the drop-in center, downtown Calgary, and also out of different centers around the city. And you'd help people with chronic pain or people with addictions that are going through. So I believe in order to be part of the program, you had to be clean or trying to get clean. And then we would go in and do free acupuncture to try to help. So it was great. We got our clinical hours, so everyone would kind of volunteer and sign up, but we learned so much. And those patients always stand out in my head because we worked with people. And the place that I was at, you were homeless for I think at least 6 months to get into the program, and then you work with their addictions while doing it. So I once had somebody come in and he was definitely on a lot of drugs, and I was like, I don't know, like I'm a student, how am I going to treat this? And I learned from this Dr. Alex, who was so cool to learn from. He was such a smart guy, and he said, well, go in and sedate him with the needles, help bring it out of his body. And I said, well, this work? Like I'm a student, I don't know what I'm doing. Yeah, go in and see. I'm like, okay. So I go in and I sedated him, and he passed right out, and he got up after, and he's like, oh, I feel so good. I'm just going to go back to my room. I'm just going to relax. And so we helped him going through the process, and so many others, right? Because sometimes it's not even like, the street drugs are coming off of, or it's the other stuff. Like it's coming off of anti-anxiety medication or antidepressants. Like your body adjusts to that. Post-op surgeries, the amount of stuff, like the morphine they're giving you or whatever you're on, right? Like your body is not meant to really have this.
Yeah.
So it's treating your body through that. So yeah, we definitely can support bodies going through it. And yeah, smoking is something I've definitely treated before smoking cessation in the past. And it just helps with cravings essentially. Yeah. So, and sometimes I do ear seeds. So I'll put in these little seeds in people's ear. And then if they're having a craving, they'll push on them and massage the points. And then that can help too, because it stimulates, it's kind of a microsystem in the ear. So it'll stimulate different organs and do different things.
Interesting.
Yeah.
Wow.
Yeah, the nervous system.
Oh my God.
That's a lot of information.
They're learning lots. I know, and I feel like I could have chatted on and on about fertility, but I'm like, if people have any questions, just email me.
Yeah.
We can talk about stuff like supplements.
I have questions. I'm going to email you.
Yes.
We have lots of questions now.
Come for treatment. Just book a treatment and come
I got problems, girl. Don't worry.
I feel like we're just uncovering so much. There's never enough time in just the 1 hour.
I know, it goes by so fast.
I know. And I'm always worried every time I sit here. I was like, well, do we have enough time? I feel like I'm not prepared. And then we get chatting and it's just like, stop clock, stop for a second. So we're almost out of time.
Yes.
But before we leave, thank you so much for joining us at the studio and sharing all your entire all your knowledge and much more, which we're probably going to learn after we go off cameras, because we always do. Before we go, I want to ask, so what's next?
Oh, that's such a good question. Guys, I don't even know the answer to it. Like right now, I'm loving my practice where it's at. I had this conversation with my husband because he keeps saying, when are you going to open your own clinic? Like, let's go. But I'm just loving my time with my daughter right now. And I'm so happy where I'm at. So I think I'm just going to keep taking these side courses that I love to take, keep building my knowledge, and then focus on my family and trying to find a better work-life balance, because I'm really bad for that. I'm such a workaholic. And anytime a patient needs me, I want to be there. Yeah. So I'm trying to now separate that and be like, no, this is my work hours and this is my time with my little one. And right now I'm just so focused on my little one, and we're trying to have another baby, and that has been super challenging. So I just want to try to nourish my body and do some self-care and not go 100 miles an hour. Yeah.
That's also really hard. Yeah. To not go 100 miles an hour.
It is.
It's a good reminder for all of us.
Right?
Yeah, exactly. Yeah. Spoken like a true mom.
For sure. It's just anyone.
Yeah. Well, thank you again, and good luck with all of that. And yeah, we can't wait to see what you're up to next.
Maybe we'll all be pregnant at the same time.
Okay, we'll come in. And then we'll do treatments.
Not leave a needling party.
Yes, you can see it, the whole team. We have a great prenatal chiros too.
Oh, awesome.
And I wanted, can we really fast?
Yeah, for sure.
Yeah. I just wanted to list different resources for people that were postpartum, because I think that we didn't touch on that. So there's a few different places in Calgary, definitely different psychologists. I love Solana Counseling. I loved them after I was postpartum. Mission Acres has some amazing psychologists. Moss Pope Postpartum House also has, they're just great for anything postpartum. And they have a really great pelvic floor physio, because we didn't touch on that. Renee Hunter is amazing. So if anybody is having incontinence issues or just any pelvic floor stuff before you have a baby, please see a pelvic floor physio or pre and postnatal chiro. See us, check in, and we'll get you all sorted.
Awesome. Thank you so much for sharing that.
Yeah.
I think people forget about that. So I'm like,
I didn't even know.
Yeah.
stuff that exists.
Oh yeah. That's another episode maybe.
Yeah, we'll have to have you back again to share even more. I'm sure we can go on forever.
Sure. Well, thank you so much for having me.
Thank you so much for being here. Okay, that's all for us today, Ham Fam. Don't forget to give us a thumbs up, subscribe to our YouTube channel. Always, leave comments and slide right into our DMs for things you want us to cover. You will have a story to share. Other than that, be kind to one another, and most importantly, love yourself even on the hardest days.
Bye.
Bye.